cardiac surgeon warns, this sleep habit is damaging your heart after 60. If you make just one of these mistakes tonight, your heart may not survive until morning. Most people your age make at least 3 of them without realizing it. I know that sounds dramatic, but what I am about to share could genuinely save your life. Tonight, I am going to show you the silent mistakes that happen while you sleep, the ones that don't cause pain, don't trigger alarms, and don't give second chances. More importantly, I will show you how to fix them before your head hits the pillow. You won't want to miss the final habit, or 99% will miss the last tip and will stay stuck with heart-damaging patterns for life. Many people believe that the heart is safest when we are at rest. But for those over 55, nighttime is often when the heart is under its most dangerous kind of stress. It is a quiet building pressure that occurs while you are unconscious. Blood pressure shifts, breathing patterns change, and oxygen levels can dip to critical lows. These small, seemingly harmless habits become life-threatening when combined in the dark. For decades, surgical research has shown that most nighttime cardiac events are not random occurrences. They are the result of preventable mistakes that people don't even know they are making as they drift off to sleep. The first mistake is incredibly common: going to bed dehydrated. Many seniors intentionally stop drinking water in the evening to avoid waking up for bathroom visits. While this feels practical, it causes the blood to become thicker and more viscous. Thicker blood is much harder for the heart to pump efficiently, causing circulation to slow and increasing the risk of clot formation. Between 2 and 6 in the morning, your heart rate naturally drops and blood pressure fluctuates. This combination of slow circulation and thick blood is exactly when heart attacks and strokes are most likely to occur. A small half cup of water shortly before bed keeps the blood flowing smoothly during these vulnerable hours. The second mistake involves your physical posture, specifically sleeping completely flat on your back when the heart is struggling. As we age, the heart's ability to handle fluid shifts begins to change. When you lie perfectly flat, fluid redistributes toward the chest, increasing pressure on the lungs and making it harder for the heart to function. If you have ever woken up gasping or feeling short of breath, your heart is likely struggling under these nighttime conditions. Elevating the upper body by just a few inches can significantly reduce this cardiac stress. You don't need a medical bed. A gentle incline helps the heart and lungs work in harmony while you rest. Taking the wrong kind of helper before bed is the third major error. Sleep aids, over-the-counter nighttime pain relievers, and even certain supplements can interfere with breathing and lower oxygen levels in older adults. Many of these medications do not cause obvious pain or symptoms. Instead, they quietly destabilize heart rhythms or allow oxygen to drop just enough to trigger a fatal event. This risk is exponentially higher if you already snore loudly or wake up feeling unrefreshed. Always ask if a medication is heart safe, specifically for nighttime use, as the body's reaction to these substances changes when the metabolic rate slows during sleep. The fourth mistake is the habit of dismissing nighttime symptoms that have become normal over time. Humans are incredibly adaptable, and we often tell ourselves that loud snoring, gasping, or morning headaches are just part of getting older. However, these are often signs of sleep apnea, a condition where oxygen levels drop repeatedly throughout the night. This forces the heart to work much harder under suffocating conditions, dramatically increasing the risk of sudden death. Ignoring these symptoms doesn't make you tough, it makes you vulnerable. When nighttime breathing is stabilized, heart rhythms often follow suit, preventing long-term strain on the cardiovascular system. Everything discussed so far leads to the final, most impactful mistake: going to sleep with a stressed heart. Most people view stress as a daytime problem involving bills or family issues, but the emotional state you carry into bed determines how your heart behaves for the next 8 hours. If you go to bed anxious or mentally overstimulated, stress hormones like cortisol and adrenaline remain elevated. Your heart rate stays higher than it should, and the heart never gets the chance to enter recovery mode. This unresolved stress is a common thread in patients who show healthy daytime results but suffer dangerous heart disturbances after midnight. Your heart is designed to slow down and repair itself at night, But it cannot do that if your mind is replaying worries or scrolling through alarming news. From a physiological perspective, the body reacts to mental threats exactly as it does to physical ones. This is why creating a buffer zone between your day and your sleep is a medical necessity. A simple 20-minute wind-down routine, dimming the lights, slowing your breathing, or meditating, signals the nervous system to shift into recovery mode. When your breathing slows, your heart rate naturally follows, allowing the organ to finally rest and rebuild. None of these mistakes feel like emergencies in the moment because they are habits, not sharp pains. However, when you skip water, sleep flat, take risky aids, ignore snoring, and carry stress to bed, you set the stage for a breaking point. Awareness is the first step toward resilience. By making small, gentle corrections tonight, you support your heart during its most testing hours. Better sleep leads to stabilized blood pressure, reduced inflammation, and improved mental clarity. Nighttime care is the foundation of a healthy life, ensuring your heart is ready for the day ahead. If this information changed how you think about your evening routine, consider the habits of those you love. Heart health in the dark is a silent battle, and prevention is always more powerful than a reaction. The heart doesn't often give a warning bell when it has had enough, so the best time to act is before the lights go out. Taking these steps is not about fear, it is about giving your body the respect and support it needs to keep you going for years to come. Your safety tonight is a reflection of the choices you make before your head hits the pillow. Subscribe. I've always avoided water after 7 p.m. to keep from getting up, but I never realized it was making my blood thicker and harder to pump. I'm going to try that small half glass of water tonight. Does anyone else find that elevating their head with an extra pillow helps them breathe easier through the night? Would you like me to find a simple 5-minute breathing exercise that is specifically designed to lower your heart rate before you fall asleep?